ncIMPACT is made possible by funding from Civic Federal Credit Union. ncIMPACT is a production of UNC-TV Public Media North Carolina in association with the University of North Carolina School of Government.
Education, jobs, health, all these issues affect you. Leaders from across the state, people just like you, are working to make things better. The question is, could you do this in your community as well? I'm Anita Brown-Graham. This is ncIMPACT. There are tens of thousands of people with serious mental illnesses detained in jails all across North Carolina. While sitting in jail, those suffering from mental health and substance abuse problems rarely get the treatment they need. Granville Vance Department of Public Health coordinates the first multi-county effort in North Carolina seeking to get individuals with mental health issues out of the criminal justice system. Let's look at the impact of the 5-county Stepping Up initiative.
After my playing days, I left the gym and I hurt my back. I don't actually know how I hurt my back, and I got prescribed opiates. It did something to me that I can't explain. I was physically addicted to the opiates. I've been diagnosed as bipolar. Most people who are, again, who has a mental illness, 3/4 of those people have a substance use problem, and I'm one of those people. Prior to getting clean, I was incarcerated at Pitt County Detention Center for 5 months. After my 5 months there, they asked me what I wanted to do, and I told them I wanted to go to a long-term treatment program. I went to a 2-year program in Durham, TROSA in Durham, where I found my purpose, and that's helping other people like myself.
The Stepping Up initiative was started by the National Association of Counties and also NAMI in 2015, and it gives us opportunities for counties to find ways to alleviate people with mental health issues and substance use issues that are nonviolent offenders, to try to keep them out of our jails and find them proper treatment.
What we've learned from our jail administrators in this 5-county region is that they see a lot of the same people over and again, and a lot of the same people that they see in our local jails are not necessarily hardened criminals. They might need to have health care attention, and that would better serve both them individually and the community.
Going on 6 years of sobriety, I made a decision, and I act on the decision. And if I hadn't have done it, I don't think I'd be alive today. I really don't. I get up every morning and I go to bed every night with gratitude. If you can save one life, we've done a lot.
Bob, let's start with you. Thinking through the numbers of people in our jails with substance abuse or mental health issues, are we just getting better at identifying people, or is the issue that the problem is actually growing?
I think we are getting better at identifying those individuals with mental health and substance use in jails, but it is a major problem and has been a major problem for a long time, and those statistics that you mentioned reflect that. For individuals with mental illness who go to jail, about 3/4 have a co-occurring substance use disorder that complicates their treatment. About 1/3 of people, of those with a substance use disorder, will have a co-occurring mental illness that, again, complicates their treatment. So it is a major issue that many counties around the state, many counties around the country are grappling with.
So Robin, let's go to you. What are the options for services, for treatment for this large number of people in jails with substance use and mental health issues?
Well, for the last few years, we've been worried about emergency departments and jails becoming the safety net for folks with mental illness and not a place to get treatment. And so seeing an opportunity to connect folks who have been in jails to treatment is essential. So, and counties have different kinds of services available to them. Of course, inpatient hospitalization is the most acute level of care that someone can be given, but we're looking at the opportunity for folks who have been in jail and who have mental illness to connect with local community services. And sometimes that happens in the jails. You know, in Alamance County, we know that there are GED courses that are taking place in our jail, and AA sessions are happening in jails. But we're looking to see if there are other kinds of ways to get folks connected on reentry back into the community.
So Dana, when you think about this from your perspective, what are the opportunities that we may be missing?
So I think there are a lot of opportunities that that providing services or linking people to care and diverting them from the criminal justice system, there are a lot of opportunities for us to jump on. I think that over time, we've slowly seen a decrease in the number of services that are available to people with mental illness or co-occurring disorders. And we have, which has led the jails to become sort of the de facto mental health providers. And so what that means is that we really need to both think critically about how to link people to care so that we can divert them from the criminal justice system and divert them into the care that they need in the community setting. And so we're that really requires for us to engage in partnerships that really haven't existed in the past. And so it really creates an opportunity for us to give more of a holistic perspective on both identifying those who need treatment and then linking them to the care so that we don't put them within the criminal justice system.
So Bob, I want to come back to you and stay on this topic of opportunities for a second, because we've heard both Robin and Dana suggest jails might be becoming the de facto place for care. Respond to that for me.
Well, unfortunately, jails are a de facto place. If people end up not getting the care they need in the community, then they often end up getting in trouble with the criminal justice system and ending up in jail. Emergency rooms are also a de facto place where people who end up not getting the care they need often show up. Much is being done to be able to divert those individuals from the criminal justice system to treatment in the community when that can be done at little risk to public safety. And the vast majority of people who end up in jail with a mental illness are there typically on fairly minor crimes that are more of a nuisance sort of crime than a threat to public safety.
Many county jails lack mental health clinicians or substance abuse professionals to provide services to those who need that help. Let's look at the impact of a telemedicine mental health clinic in the Franklin County Jail. It allows detainees to be assessed by a licensed psychiatrist right there in the jail.
Prior to video conferencing, we just went once a week and did a weekly clinic in jails. But it was clear that just once a week isn't enough for a jail, that often they will get a detainee in all of a sudden who's acting bizarrely, unstable in some way, and need an assessment much more quickly than waiting a week.
We've had some to come in here, we'd had to keep in a padded room that was so bad. Since Dr. Coy has had several sessions with them, in their tenure here, we hadn't seen them back.
The inmates are now getting the treatment that they once weren't getting, and they're stable. We're able to manage them better, and the environment of the detention facility and wherever they may be is better.
When a person with mental illness comes into a jail, they're not going to get a therapeutic intervention from an officer. It's just not the officer's role.
Without medical records, we can't do much of anything. And so it is important that you have a psychiatrist that is able to identify issues with the inmates and then make a diagnosis and treatment. We're not doctors, we're not nurses. You do have a nurse on staff, but to have a professional psychiatrist is much greater.
We are a group of psychologists primarily, and our role is to address the needs of the client, the detainee that we see in the jail, and then ideally through this stepping up process, try and navigate a way for them to get out of the jail when they're in on a nuisance charge. That's the real effort, is to be able to navigate them out of a legal setting that's not really appropriate for them and a healthcare setting that is.
Robin, Tell us about the potential impact of programs like the Stepping Up Initiative. Why are you so excited about the promise of this program?
I am excited about the Stepping Up Initiative because while it's a national program that's just a few years old, North Carolina is one of the leaders in the country. We have 46 counties where the county commissioners have signed a resolution saying we want to reduce the number of people who have mental illness in our jails. And that is a huge impact to just have people in a community talking about it.
So what is Stepping Up Initiative? What does it do?
The Stepping Up Initiative is a framework with the goal of reducing the number of people who are in jail who have mental illness, reducing the length of stay that they're in jail, decreasing recidivism, and connecting people to services once that they are released from jails. And basically it's to provide resources, conversations, the opportunity to link together community members to have discussions about what works in your community.
Bob, is this a one-size-fits-all solution?
No, and in fact, each county, each community that is involved in Stepping Up really looks at their local community. Part of that process involves taking a look at each stage of the criminal justice system as people with mental illness go through that or have contact on the initial end to see what can be done locally, what resources could be tapped, could be combined, what the opportunities are to develop better ways of diverting those individuals that don't need to be in jail to treatment in the community. It really is not a one-size-fits-all. In fact, each community needs to come up and each county needs to come up with its own solutions that work for them because not every community is alike. Not every county will have the same resources or the same strengths or weaknesses.
So Dana, let's talk about the value of a framework. Why is that helpful to a community as it tries to wrestle with this issue?
So I think frameworks give communities structure around how to think about getting to or solving a problem. And so while it's not a sort of stepwise instructional packet, it helps to give clarity around what things we need to think about as we develop our very particular solutions that are focused within our communities.
So Robin, I want to come back to you for a second, if I might. 46 out of 100 counties in North Carolina have said we're going to do something about this. What are we going to do about the other 54?
Well, I'm still worried about the 46 who've signed their resolutions because what we've heard from them is, okay, we've signed this thing, now what do we do? So we've got this nice resolution, it's on a shelf in the county manager's office, so what do we do with it now?
So what are the resources available to help counties like that, Dana?
So I think the resources vary, and they vary based on the county's needs. So once a county is able to identify what the scope of their particular problem is and really assess what services they have available, then they can start identifying both the financial resources that they need, the human resources that they need, and think about what programs already exist within their communities before they even think about sort of reaching out to sort of national grants or programs. But while those things do exist, I think it's really important to focus on understanding what the community needs at the time and really what's in play for them to meet their needs.
In many rural areas, there are simply not enough mental health services. Let's look at the impact of how these 5 counties work together to share data, services, and resources.
The biggest barrier that we face here is access. More often than not, the people we serve don't have insurance, they might not have transportation, and sometimes they might not even be fully present to know what kind of options, that there are options for another way of living your life. What I love about these initiatives is that it's bringing together all different types of lenses. To be able to have a commissioner sit there and explain his point of view, to have police officers entering in this dialogue. It gives you all the different dynamics. In the same way we want to treat a person holistically, it's treating the problem holistically as well.
It's always helpful to have friends to do work together, especially when your resources are few. Partnership is even more critical, I think, in rural areas of our state, where we have to be creative and we have to come up with new and innovative ways to approach these challenging issues that we face in our communities. It's just better together.
Miami-Dade County can chunk millions at it. We don't have those resources in our rural counties. So being able to put us all together and work, and we have some common issues, but as we've developed that, we've identified strengths in other counties, and we're able to do smaller pilots and so forth, so that we're not all in on anything as we develop our program.
Just so they know that that's an option.
It's easy to get burned out in this career, and so knowing that we're all just people trying to struggle through this and giving them the opportunity to try again.
Dana, these are difficult issues. Let's talk about how you get started as a community when you're balancing public health and safety against these issues of mental illness. What are your recommendations to communities for first steps?
And so starting out with really understanding what the needs are of the community is a great first step before implementing any program. There's no prepackaged solution to this problem. I think North Carolina is doing some very unique things around understanding the needs, but also making sure that our community is trained once they understand, how to understand those needs. And so
Robin, let me turn to you, because communities need resources in order to do this work. You don't understand the needs just because you're talking to people. So what does the state offer communities?
One of the exciting things that we've done as part of our North Carolina Stepping Up initiative is that we have trained this summer a group of facilitators who can do an exercise with a county to bring together elected officials, law enforcement officers, healthcare professionals, the judicial system, hospitals, and bring folks together to a community to kind of understand and map where the strengths and weaknesses are. And it's called sequential intercept mapping. And that's one of the things that we decided that we were going to invest in, so that we would have folks in North Carolina who could provide this for free.
So what do you call to access this resource?
I would say that we call Bob Kurtz at the North Carolina Department of Health and Human Services.
I knew there was a reason you were here, Bob.
Because Bob can help facilitate. He is doing these facilitations and helping get folks to do that.
So Bob, say a little bit more about how the person who needs that resource connects with you and gets it.
Yeah, they can contact me at the state's Division of Mental Health. I can provide my email address, or nc.sim@dhhs.nc.gov is the website or the email address that you could contact me at. But we have, as Robin was saying, more than 20-some facilitators, including university professors from University of North Carolina, Chapel Hill, Duke University, experts in working with people with mental illness and criminal justice involvement all around the state that can look in a very structured way, help counties look in a very structured, methodical way at what their community resources are and what can be done. And the outcome of that is a map of their local system and an agreed upon plan for how that community is going to address these local problems.
So I've heard three things so far: the mapping exercise, the getting the right people together at the table, all these constituents or stakeholders, and then the plan. And then what comes next from plan to implementation?
That sequential intercept planning process gets those individuals together to jumpstart that Stepping Up initiative, so that the outcome is the plan, that then there are agreed upon responsibilities for each partner to be able to implement it and then evaluate the progress.
One of the important things, I think, is that these plans bring together your non-traditional partners in a way where you can identify unique resources to really then come back to serve the community and make a healthier community.
We all share many of the same challenges in our communities, so why not share the solutions as well? Each and every one of us can make a difference. That's what having an impact is all about.
ncIMPACT is made possible by funding from Civic Federal Credit Union. ncIMPACT is a production of UNC-TV Public Media North Carolina in association with the University of North Carolina School of Government.